Okay, hello. My name is Christian Mentor, and welcome to Beyond Google, searching the internet for health information. Today we're going to talk about, well, first let me tell you a little bit more about myself. So I work as the Community Engagement and Health Literacy Librarian for University of Nebraska Medical Center. So in my role, I do a lot of community outreach to connect people to quality health information. So I do presentations like this, webinars, or different workshops. So I'm really excited to be with you today to talk about how you can find and evaluate health information on the internet. I think I left out my objective slide this time. Normally I have a slide with my objectives, but my goal for today's session is that you would come away knowing what are 3 key questions that you should ask when you are evaluating the quality of health information. And those questions can be applied to any type of material. Today we're going to be talking about websites and online information, but you can apply it to print materials as well. And then we'll also talk about some specific resources that can be some of your go-to websites so that you don't have to do a Google search and you can go straight to those websites to find the information you need. So hopefully you'll remember the 3 questions, and hopefully you'll also walk away remembering at least 3 websites that you find are relevant for you. So before we get started on the presentation, I would like to know a little bit more about you and your health information seeking behaviors. So I'm going to launch a poll, and I want you to take a moment and think, what was the most recent time that you needed health information, and where did you go first? So hold on one moment. All right, so you should see a poll pop up on your screen. And I want you to select one option for the type of resource that you went to first the last time you needed health information. And I'm going to give you a moment to fill that out. All right, I still see a couple more answers coming in. We'll give it a few more seconds and then I'll show the results. All right, so you should be able to see the results on your screen. So we can see here that 100% of you said the internet is the first place that you went last time you needed health information. And so that's not surprising, since we're in a session talking about finding information online. It's probably not surprising at all that most of you would go to the internet first. So thank you for participating in that poll. All right, so here is a similar survey that was conducted by the National Cancer Institute. They do annual surveys to, there we go. Annual surveys to track health information trends. So one of the questions they asked the participants was where did they went the first time, where they went first the last time that they looked for health information. So you can see here the results are pretty similar to yours. Obviously they had a larger survey pool, but 70% said they went to the internet first, about 17% went to a healthcare provider, and then a smaller percent used books or pamphlets or family and friends. So we can see that health information, oftentimes people are going to the internet first for their health information. And there's also data from the Pew Research Center that of those who do go to the internet first, 80% of their searches start with a search engine, such as Google or Bing or Yahoo. So the internet has become an increasingly important resource for instant health information. And so that's why it's really important for us to talk about how do you know which resources you can trust. So we're going to start with some easy questions to consider when you need to evaluate the quality of health information, websites, and online resources. And I also want to add, feel free to post questions as I go along. Post questions throughout the presentation. You don't have to wait until the end, and I will check every once in a while. Once we get to this first section, I'll see if you have any questions about the evaluation before we move on to websites. Okay, so this resource is called Trust It or Trash It, and it's been developed by Genetic Alliance. So they have come up with 3 basic questions: who said it, when did they say it, and how did they know? So let's start with the first question: who said it? So when we think about who said it, we look for information that has the author listed. So the author should be easy to find. If there's no author listed, that's a big red flag. The author should have experience. So if you are looking at information about eczema, you'll want your writer to have experience in dermatology or dealing with skin issues. If the author has no experience, that may be something that you want to stay away from, or at least not use as your primary resource. That you want them to provide the source of information. So not just have experience in this topic, but also tell you where they found their research. So what types of articles or books are they using to back up what they're saying? And then you want your websites to not use the information to advertise a specific type of treatment or product. So if the sole purpose of the website or the resource is to sell you something, then that's not a resource you want to use for your health information. So here's an example from the Academy of Nutrition and Dietetics. They have a website called Eat Right with nutrition information. And so they have an article here on 4 types of foods to support memory. So we can see here that they have the author clearly listed. And if we had, and so we see her name and we see her credentials behind her name: MBA, RDN, LD. And then if we were to scroll down to the bottom of the article, we would also see a short little sentence to tell us a little bit more about her. So Marissa Moore is an Atlanta-based registered dietitian nutritionist. So the RDN stands for registered dietitian nutritionist, and the LD stands for licensed dietitian. But even if you didn't know what those credentials stood for, at least they tell you that she has the background and expertise to write an article about how foods and nutrition support memory health. So most websites will list the author somewhere, or web pages will list the author somewhere near the top under the title. So here's another example from a blog, a personal blog, talking about home remedy tips to remove dandruff from your hair. And so we see the author's name is clearly listed, but when we open up her short little bio, we see that Andrea Laura is a very creative writer and active contributor who loves to share information, share informative news or updates on various topics, and brings great information to her readers. So by looking at her bio, we can see that she loves to write and she loves to share information, but we see no proof that she has an expertise in the area of dermatology or dandruff and things like that. So this is something where you wouldn't want to use this as your primary source, and there are definitely more reputable and trustworthy resources out there. So we are currently, while we're talking about experts and who has expertise, we're currently in the middle of a pandemic, COVID-19, and there's a lot of information going around the internet on social media, websites, blogs. There's, you can share information for free, there are no restrictions, and everyone has an opinion on how you should manage this condition, how it's spread, what are potential treatment options, and it can be very confusing to figure out who you should listen to. So you want to think about, what is their professional expertise? You want to look for people who are working in the healthcare field, in public health, in science, that have a background in some of these areas. Do they have experience treating or researching infectious disease, a virology, since COVID-19 is a virus. Do they have experience treating or researching respiratory illnesses? Epidemiology. Epidemiology is a area of health and public health that focuses on tracking health patterns and the causes of different health conditions, diseases, or health events, and how those events and conditions affect a specific country or neighborhood. So you want someone who has experience with tracking these types of health events and knowing how to control them. And then disease surveillance is also a part of epidemiology as well. But I've seen, and I'm sure you have as well, I've seen people who don't have a medical degree, who have their expert opinion, quote unquote expert opinion. I see people who may have work in the healthcare field, but they don't really have a lot of experience as it relates to infectious disease or disease surveillance, but they have an opinion as well. So you want to think about not so much of like having a steady list of all the trustworthy people, but think about who are these people? What were they doing before the pandemic? And how is the work before the pandemic relevant to our current situation? We have some national experts like Dr. Anthony Fauci, but in each of our communities, we also have local experts. Like here in Omaha, we have some local doctors with Nebraska Medicine that have been really active on social media with Facebook Live videos and things like that to share expertise. So look for those people that have the experience in the areas related to tracking, treating, and researching this type of disease. So sometimes the author of materials and websites is not one individual. Sometimes it's an organization, or it may be a committee of writers. So for example, the Centers for Disease Control and Prevention, the American Lung Association, the National Heart, Lung, and Blood Institute. These are all national associations or government agencies that put out health information, but they're not going to have one person responsible for writing all of it. So in that case, you want to look for the About Us details. The mission statement, the contact information, it should be very clear who they are, what they do, and you as a consumer should be able to easily reach out to them if you have additional questions. And then if they have an editor, a group of editors, they should have those names listed somewhere on their website. And then as well for sources of information. So here we have an example from the Office of Women's Health. And they have a page on caregiver stress. And so if we were to scroll down to the bottom of the page, we would see that they have a list of their sources. So they list the websites, articles, books that they use to put together this page and where they receive their facts as well. So ideally, you want to see both the author and the sources, but sometimes, especially with some of the websites created by organizations, they may not have both. And so you're depending partly on their reputation as an organization for their expertise in that area as well. And then finally, for the who said it, you want to make sure that they're not using that information to sell you a cure or a treatment. If the website does include advertising, it should be clearly identified. And then if the health information is written specifically to sell the product, then that's not what you want to use to inform your healthcare decisions. All right, so that was question number 1. So now question number 2, when did they say it? When did they say it? We're looking at whether or not there's a date of publication, review, or update. If there's no date provided, then you don't know how accurate, or I should say, you don't know how current the information is. With some types of health information, it changes very frequently. So for example, if you're looking at information on human anatomy, something for 7 to 8 years ago is probably going to be okay. But if you want to know about immunotherapy for cancer treatments, which is something that's changing every year, you don't want something from 10 years ago. So it's really important to know how current the information is and if it's still relevant to your topic. And if it's outdated, then you definitely don't want to use it. So you want to look for a date at the beginning or end of documents and web pages, and it'll say something like last update, last review, review date, revised, etc. So here's another, we're coming back to our article from Eat Right website. So we see, in addition to having the author's name, they also have the date it was published. So it was published in October 11, 2019, but then it was also reviewed in March 2020. So we see that it was published and then they came back and reviewed it. So we know that it's definitely up to date and something that we can use. And our final question, how did they know? So when looking at how do they know, we want to know, was the research based on multiple people or multiple studies, or is it based on personal opinion, one person's experience, or a study of a small group of people? Does it match what you found in multiple sources? So there should be some consistency. So if I find something on the American Diabetes Association website, it should be pretty consistent with what I find on the National Institutes of Health website or on a textbook about diabetes. If it's like way far away from what others are publishing, and there's no explanation for why there's that such a difference, then that's something to be concerned about. And then if it's too good to be true, it's promising a miracle cure with not enough science to back it up. On the flip side, there is sometimes new and cutting edge research that we just don't have enough research yet to provide a full explanation or a lot of proof. But in that case, it should be clearly identified that this is based on something new, maybe a new, small study has come out and more research is needed or things like that. And so we're seeing some of that now with COVID-19 and trying to find appropriate treatment. And so you may have seen on social media about a month ago, information started spreading quickly about hydroxychloroquine and chloroquine, which has traditionally been used to treat malaria and also been used for rheumatoid arthritis and lupus. And so someone posted something on Twitter about the potential for treating COVID-19, and then it just spread like wildfire. And so for those of us who are not in the medical field and not researchers, it can be overwhelming to see the amount of information and the amount of opinions that are going back and forth about this potential treatment. And it may be hard to understand if it has promise, why is it not widely being available yet? And so I've included a couple of links, and I will make my slides available. But these articles kind of explain where we are with treatment options and the fact that the studies that we do have so far have either been small studies or the description of the study has not met the reporting requirements that are expected for conducting human research, or maybe we don't have controlled clinical trials that have been completed yet. So in addition to being studies, the studies have to be conducted a certain way to ensure safety and to report on the results in a way that we have all the details. So this is still a work in progress, and so that's why it's not fully available yet. And so the Center for Evidence-Based Medicine in the United Kingdom has identified 142 clinical trials that are currently going on for this treatment option to continue exploring whether or not it's really effective. So this would be an example of needing multiple studies and also needing larger groups of people before we can make a definitive decision on whether or not it's effective. All right, so those are our 3 questions. Who said it? When did they say it? And how did they know? And I'm gonna check and see if I have any questions so far before we move on. All right, so I don't see any questions, so we will move on to our website. Oh, I see a question from Dora. What about sites that sell products that are based on a lot of research published in reputable journals like PubMed? So good question. So there are pharmaceutical companies that create websites to promote their products. And so they usually will, and they should, if they're approved by the FDA, they should have clinical trials, or they should have other research that is available to promote why that medication would be effective, any side effects and things like that. It's not to say that the information on their website is incorrect or misleading, but you don't want to depend on that website alone for your information because you realize that there is bias. So if a manufacturer or pharmaceutical company has created a website to promote their product, they have a purpose. They want you to use it. They want you to go back to your healthcare provider and ask for that resource or that medication or treatment. It doesn't mean that it's bad. It just means that they have ulterior motives for giving that information. So you can use that website, but you want to use it along with other resources. So maybe you could, go to PubMed. You mentioned the PubMed database. You could go to PubMed and see what are the other articles available that maybe they haven't included their website. You can look at other consumer-friendly websites to see what information they have. You can also talk to your local librarian and ask for their help with researching as well. So not that it's all bad, but you just don't want to depend on that website alone for your information. And as you mentioned that they have articles, then you definitely want to go look at those articles for yourself. So again, it's not that it's bad, but you just don't want to depend on the website and what's on the website alone if their purpose is to sell you something. You want to look and see if they provide links to other resources, then you want to go visit those links directly for yourself. I hope that helps. Oops, sorry about that. Hit the wrong button. Okay. I hope that has helped answer your question, Dora. Okay, so all right, great. Okay, so I gave you a list of criteria that you can think about when you're evaluating information. But let's be honest, we don't always have the time to go through all three of those questions and thoroughly research everything. Sometimes we just need that website that we can get to right away and get the information we need. We want to know in advance, can I trust this website or not? So I'm going to give you some websites that you can go to. The first one is Medline Plus. Many of you may have heard about this resource already. And this website is created by the National Library of Medicine. It is written for patients and families. It has zero advertising. It has a very clean design. And so I'm going to do a little live demo of this website. So hold on one moment. Okay. All right, so if you look on the left-hand side, we'll see we have health topics, drugs and supplements, videos and tools, medical tests, a medical encyclopedia, and healthy recipes. Those are the major categories of information that are provided on this site. And there's also a search bar on every page. So you can search this website just like you would Google. And this website doesn't have a lot of original content, so they don't go out and create their own articles. But what they do, there's a staff at the National Library of Medicine that go out and look at a variety of websites. They evaluate the criteria, and if it meets their expectations of what they're looking for, they will add it to Medline Plus. So it's like someone's already done the work for you. And you also is a great way to not have to remember all the different websites that are out there. Because this website will connect you to other places like Mayo Clinic, FamilyDoctor.org, EatRight.org, and so many others. So I'm going to do a quick search. And if someone has a suggestion for a topic for me to search for, you can put that in the chat box. So if you have a health topic you want to see me do our practice exercise, our practice search on, you can add that to the chat box. So I have a couple in mind if I don't get any suggestion. All right, so I will, oh, do we have a suggestion? All right, role of fruits and veggies in immunity. Great. So let's start with nutrition, because that's where that falls under. Nutrition and how foods help our bodies and our immunity. So I'm going to start with nutrition, or actually, let's see. Yeah, we'll start with nutrition. All right. So this is what a search results page will look like. So on the left-hand side, you'll see that you can, they organize results by health topics, all the different categories within their website, or external health links would be all the different websites and web pages that they link within their site. So if you just want to look at all the external health links, you have that option, or if you want to look at, the different categories of information in their website, you can do that as well. So we'll see that they have a topic page related to our health topic, nutrition. And so a health topic page always has a table of contents at the top. So it starts with basic summary, and then you can learn a little more details on your topic. The See, Play, Learn has interactive tools. There may be videos, photos, or images. Whatever they have that's more interactive will be linked under that section. If you're interested in journal articles, clinical trials, or statistics, they have that under the research section. So if you want to see the type of literature that health professionals and scientists are reading, that's where it will take you. It takes you to PubMed. And they have the Find an Expert. So if you want to find a nutrition expert, that's there. And then they also have the For You section, which will break down information by a different demographic. So if you want information just for teens or older adults or men or women, they will have that link there as well. And then I also want to point out on the right-hand side, they also identify any other pages within Medline Plus that are relevant to this topic. So we see here on their encyclopedia, they have like eating out, fast food tips, healthy food trends. And then they have other related health topic pages, such as food labeling or food safety. And then if there's a National Institutes of Health that's relevant to that topic, they'll show you that information. And if there's information in other languages, you can find that here as well. So that's just a brief overview of what a health topic page will look like. So I'm going to go back. And then the drugs and supplements section covers over-the-counter and prescription drugs. So you can find the type of information that you would get from a pharmacy, to the little printouts that you usually receive with your medication that tells you how often to take it, what to do if you miss a dose, what to do if you overdose, any side effects. All that information is here. So we'll just look at Tylenol really quickly. And we'll see this is the type of information they have. So why do you use it? Any dietary restrictions, brand names in case of emergency. So if you lose your information from the pharmacy, pretty much everything they cover is also on the Medline Plus website. And then I'm not going to look at the herbs and supplements pages, but it's the same thing. They cover the same information. Most of the common dietary supplements and herbs would be there. If there's something you're familiar with that you don't see here, it's just because we don't have enough literature yet to tell whether or not the dietary supplement is effective or does what people claim that it can do. So not only do they tell you information about the supplement, but they also tell you what is the proof that we have that actually can improve your health in the way that people claim. And then for medical tests, it pretty much, most of the medical tests that a doctor would order, you can find it here. And they'll tell you why that test would be used, how you prepare for it, if there are any risks, how to interpret results. So not specific to your specific condition, but just in general, like for example, for a cholesterol test, they'll tell you like what's the normal range and what does it mean if your results are outside the normal range. Medical Encyclopedia has different articles and images for various different health conditions and treatments. And then the Healthy Recipes section is something that was added within the last couple of years, and they're still adding more content to this section. And so they have the recipes divided by the type of meal, but also the type of dish. So you can, if you want to see breakfast food, you can, or if you want to find a soup or a salad, they have it organized that way as well. All right, so let me go back to my slides. All right, and also Medline Plus comes in, I don't know if I mentioned English and in Spanish. There are some resources available in additional languages as well. So as I mentioned, there's over 1,000 health topics available. These are just an example. You can pretty much anything that you're looking for, you can find it here. So not just diseases, but things like first aid, disaster preparedness. We're in tornado season here in Nebraska. So they have a topic page on tornadoes. If you have a pet, they have a section on pet health. If you want to learn about talking to your doctor or things like that, they have those topics covered as well. And as I mentioned, they link to many other trusted organizations. So federal government agencies, national organizations and associations, Mayo Clinic, and many others. So Medline Plus also has a magazine. The magazine comes out quarterly. If you want to subscribe, you can go to the webpage. You can read all the articles online, or if you want to receive a print subscription, it's free as well. And they come out 4 times a year. The website itself is in English and Spanish, but the print copy of the magazine, unfortunately, is only in English at this time. But they usually feature different celebrities who have had experience with specific health conditions, and they talk about their experience overcoming that or managing that condition. But they also feature the stories of everyday people like you and I, and their experience with health and wellness. So the NIH also has a newsletter. So theirs comes out monthly, and it features information on research from the National Institutes of Health, and then different health issues that may be relevant. So this month, their cover story is about autism. And last month, their cover story was about strength training at any age. So you can read these newsletters on the website, but you can also go online and subscribe to receive a free copy in the mail every month. And for those of you who may want to see copies of these magazines or newsletters come to like your place of worship or your local doctor's office, they do provide bulk subscriptions as well. So you can also pass that information on as well. All right, so I wanted to highlight 2 resources for teenagers. The Boston Children's Hospital has created a website for young men's health and a website for young women's health. And it's geared towards teenagers and young adults, as well as their parents and educators. So it covers general health topics that are relevant to teens and young adults. It also covers sexual and reproductive health, nutrition and fitness, and emotional health. And there are different topic guides or health, they call them health guides, with information on different health topics. They also have an Ask Us feature where teens and young adults can submit their health questions, and they'll have a panel of experts that will respond to those questions. I believe they pick 1 or 2 a week, maybe. And they usually try to pick questions that are very common that most would be interested in. So it's really important for teens to learn how to be an advocate for their own health, to learn about their own health and wellness as they get older and need to manage their health on their own. So these are great resources for them to find age-appropriate information. And then going to the other end of the spectrum, we have information for older adults as well. So if you want a website specifically about healthy aging, the National Institute on Aging has a health information website. It's similar to Medline Plus, but doesn't have as many topics because they focus specifically on health conditions that would affect older adults or affect adults as they age. So they have some of the, you see on the screen, they have some of the most popular topics listed on the top, things like heart health, depression, advanced care planning, but you can also, they have a to Z page where you can browse the whole list of all the topics. They also have exercise and nutrition section where you can look up photos and explanations for how to do different easy exercises at home. You can also find information for how to incorporate exercise and activity into your daily life. And they have links to videos as well. And so they have a YouTube channel with videos on exercises for older adults. And they're like, some of them are as short as like 10 minutes, and others go up to 30 or 60 minutes based on how much time you have. You can find, you know, flexibility, balance, strength training, and they're all very easy to do from home with equipment that you have at home. They also have some resources that you can order in print. So on the left-hand side, you'll see exercise and physical activity booklet, and then a little one that says workout to go. So those both have the exercises they feature on their website. You can also order that print copy to have at home. And then the age page handouts are really great information on a variety of different topics, such as choosing a doctor, healthy eating, high blood pressure, you know, sexuality in later life, pretty much anything that you would want to know about, you know, driving as an older adult and things like that. They create little age page brochures and they provide them for free. So they're one of the few agencies that are still sending out free materials as well. So you can read them online or order them mailed to your home. All right, so the Centers for Disease Control and Prevention has found that almost half of people in the US are using at least one prescription drug, and almost 25% of people are using 3 or more prescription drugs. And so some of you may be caring for a family member or a friend that has multiple medications, and sometimes they aren't well organized and they may not be in the original container. So National Library of Medicine provides Pillbox, and this is a website that helps you with identifying medication and also finding more information on its use. So you can search by the name of the medication if you already know, or you can describe what it looks like. So any letters or numbers that are on the front, the shape or the color. So I'm going to give you a quick demo on how that works. So I am going to say that I have a pill that has the inscription, the imprint APO GLP-5. And then the shape is round. And the color is white. And then I'm going to hit search. And so for this one, there's only one medication that fit that description, glipizide. But sometimes, depending on how common the description is, there may be multiple pills that match. And so you may have, you know, a page of multiple results and you just kind of have to scroll through to find the one that closely matches what you have in front of you. So if I were to click on the name of that drug, it opens up a page with a closer look at the picture, the size, who was the manufacturer. And then I wanted to point out this drug label link, which takes us to a website called Daily Med. And so Daily Med provides the drug label information. So anything that you would see on the front of the bottle or the side of the bottle, they have it listed here. So they'll describe the drug, how do you use it, any warnings, any side effects, what to do if you overdose. So this is similar to some of the information you would find on Medline Plus, but basically they're just giving you exactly what you find on the outside of the bottle of the prescription drug. So that may be useful as well when you're helping as a caregiver for a family member. All right, so going back. So while we're talking about medication, this is also a good time to highlight financial assistance for medication. Because as we all know, medication can be very expensive. And if your insurance doesn't cover the costs or you don't have insurance, it can be really challenging. So the Medicine Assistance Tool is a search engine to help you find discounts, savings cards, special programs, and other resources from different pharmacy companies. So you would enter your status, so whether you're the patient or the family member, and then answer a few questions, including the name of the medication, whether or not you have insurance, and your location. And then it will show you what resources are available in your community. So this particular site, they don't have their own program, but what they do is they collect information from all the different pharmaceutical companies that provide some type of financial assistance. And you can search through those and find what best matches your background and your needs. All right, so the Centers for Disease Control has also found that 1 in 5 adults are caregivers for a friend or a family member. And caregiving can be intense and may last for years. So it's important to have resources to support your health and wellness as a caregiver. So this website is the Family Caregiver Alliance, and they provide caregiver education. So they have information on different health conditions, different caregiving issues and strategies. They have some fact sheets, free webinars and videos. They also have online Caregiver Connect resources. So they'll connect you to support groups for classes and events. They'll have an opportunity for caregivers to share their stories. They have a newsletter, things like that. So it's both informational, but also a way to connect with other people that can support you as a caregiver. And the site is also geared towards, so it's both the families and also they have some information for health professionals as well, and to help them also support caregivers when they're providing care. All right, so I wanted to quickly highlight some information for COVID-19. The Centers for Disease Control and Prevention, I mentioned them already with some of the stats. They are right now considered our national resource for information on COVID-19. So they have information on how to protect yourself, what to do if you are sick, and also how to handle different community events. So we've had, different communities around the country have various public health measures, such as social distancing and things like that. And so they have guidelines for schools and businesses and things like that. So information has been changing, but this is always a good resource to come back to because they do update their website if they change their guidelines as well. They also have information on mental health and wellness. So there's a lot of stress and trauma related to either worrying about COVID-19 or dealing with COVID-19 as a patient or a caregiver. So they also have some mental health resources and information on there as well. And then I wanted to mention, for those of you who want to look at professional level literature, so the CDC website is what I would call consumer level information. It's written for the public, easy to read. Lit COVID has been created by the National Library of Medicine. And this is a kind of like an online portal where they track scientific literature. So journal articles that are written for researchers and health professionals. There are different websites available that also collect literature or make it easier to search this type of literature related to COVID-19. But I like Lit COVID the best so far, just because it's a very clean design, very easy to navigate. So they have a search bar at the top, and you can really just type in the keywords that you're looking for. But they also have different categories under the search box. So if you want to see literature related to updates on how COVID-19 is transmitted, diagnosis, treatment, prevention, case reports are articles that talk about specific patients. So not just a study of a group of people, but usually the outcomes of treating one patient or maybe 2 or 3 patients. And then forecasting deals with all the trends. So we hear talk about when is COVID-19 going to surge in our area. And so those trends as far as like how fast the growth rate or how fast it will spread is what would be under the forecasting. And they include literature from various countries. So if you want to search for information specifically from China or Italy or the United States, you can also browse that way as well. And then I want to remind you that libraries are always here for you. I know that right now, physically, all libraries are closed or should be closed, but I want to remind you that libraries have online resources as well. So your local public libraries usually have some type of health database available, and if they don't, there's a resource called Nebraska Access. This is provided by the Nebraska Library Commission. It's available to all Nebraska residents. They have different databases, so not just health information, but art, history, business, you name it. They have something related to that on their resource page. So they have different online databases and then websites that librarians have selected. And so if you want to use a database from home, you will need to log in. So you can use either your driver's license number or your state ID number, or you can contact your local public library and they'll give you a password to log in. So one of those will be needed to use the database from home. And then here at UNMC, we have a resource where you can send your medical questions, your health and wellness questions. So this is available to all Nebraska residents and any patients and families that are receiving medical care in Nebraska, but live outside the state. So you can send us your questions. We will do the research for you, and then we'll send the information to you by email or by mail. Right now it's just email, because we are all working from home right now, so we don't have the option to send things by mail. So at the moment, we're just sending information by email. But once we're back on campus, we'll be able to send things by both mail and email. So you can call us, email us, or fill out an online form with your question, and then we'll be in touch with more information. So that is, I'm going to stop right there and see if there are any additional questions. If you have any other questions, you can add it to the Q&A. And thank you for sharing the links in the chat. And I will, let's see. So I can see if we can email out my slides afterwards. If that's possible, I can also share a link where you can download my slides from Dropbox. So hold on one moment. If you have any other questions, please feel free to drop them in the chat box, and I'm going to share a link with you. And so that's a link to my Dropbox folder, and you should be able, it's a public folder, and you can download the slides there. And I'll also see if we can follow up and send them by email as well. I also have a evaluation link where you can provide feedback on today's presentation. So are there any other questions? Yes, Deborah. I see Deborah has raised her hand. Do you want to type in your question if you have one? Yeah, it's not letting me look at the chat box. All right. That's all I have for today. There's my email address. I'm always happy to take additional questions by email. I also do provide some of the services for our library. So if you have consumer health questions, you're also welcome to email me directly, and we will get back to you with more information. Any other? Thank you, Kana, for sharing that. My email in the chat box is christian.mincher@unmc.edu. And then to contact our library directly is askus@unmc.edu, which may be easier to remember. Even if you send an email to askus@unmc.edu, it will be forwarded to me as well. All right. If there, you're welcome, Dora. All right. If there are no other questions, thank you all for attending today, and I hope you'll provide some feedback on the evaluation. If there are other health information related topics that you would like to hear more about, you can also provide that feedback on the evaluation form as well. I'm always happy to talk about other topics or specific types of health information resources. So you're welcome, and thank you guys for attending.